Yeah, so in 2008 and 9, I started expanding my private practice after getting licensed in clinical psychology. And because of how junior I was on faculty, I was taking everybody who was coming in, especially because I was referred a lot of those patients that other people didn't want to treat. So soon enough, I found myself with the full practice of patients that I was wondering what was going on with them in terms of the treatment. I knew that they had some form of personality disorder. And a lot of times I knew that they have some form of difficulties regulating self-esteem, and they probably met criteria for narcissistic personality disorder. So feeling at that time that I was quite well equipped with treating people with other personality disorders, such as borderline personality disorder, I expected that I would see certain outcomes if I was using very similar interventions. But I was wrong. And soon enough, I realized that I was not really helping some of those clients move forward. And in fact, I was perpetuating some of the difficulties that brought them into treatment.
Can you say where you saw the fork in the road between what was working for the borderline people that was not working for the narcissistically inclined?
Some of the difficulties that I experienced had to do with defining type of goals that they were struggling with, and also difficulty engaging person's motivation and sense of agency in making change. But I also found that a lot of the attachment difficulties were really central to the difficulty engaging patients in my practice to kind of engage in psychotherapy that was change-oriented. And I felt that was different with a lot of patients I had experienced before that were very eager to make changes, even though that would produce a lot of anxiety. However, they also were very attached to me, and they were very interested in preserving attachment to me, and that used to be a very strong leverage to help them change.
So you didn't have that leverage, is what you were saying.
Very soon I realized I did not have the same leverage, and the same interventions were not helping them engage more in treatment, but in fact were making them retreat from treatment and retreat from attachment to me. That made me feel very puzzled, but I also started asking questions. What would actually help? What type of principles need to be incorporated into my approach so that the same treatments could be more effective? And instead of having patients that are struggling, they could really start moving forward. I spoke with colleagues.
Can you give one example of what was an intervention you would have given to like a borderline patient that has been effective, that you were finding ineffective for a narcissistic patient?
I think that some of the interventions had to do with presenting or confronting people with their difficulties that would make a lot of patients with borderline personality disorder engage more and become interested despite the anxiety. However, I found that a lot of patients with narcissistic pathology would feel very intimidated by this, and they would retreat. And that was one of the difficulties that I had.
Mm-hmm. And that would maybe point to self-esteem regulation issues or shame or something like that.
Right. That could point out to shame, but it also could point out to how they regulate in terms of their attachment.
Ah, I see.
And that made me interested in looking at the attachment literature and think what could be incorporated in treatments to make those treatments more effective.